Hello, my name is Dennis Baylor, and I'm the Overdose Prevention Program Director at Project Weber Renew. I'm also a person in long-term recovery who has revived 2 individuals who had suffered from an accidental opioid overdose by using Narcan. I'm here to talk to you about how Narcan saves lives. Before showing you how to use Narcan, I want to explain and break down exactly what we mean when we use the words opioids, fentanyl, overdose, and naloxone. First, what are opioids? Opioids come in many different forms. Some that you may have heard of include heroin, morphine, fentanyl, codeine, oxycodone, Percocet, Vicodin, and Tramadol. Opioids have been around for many centuries and are naturally derived from the poppy plant. You see, there are receptors in the human brain that control pain. Opioids block these receptors, giving someone a sense of relief, calm, relaxation, and slowed breathing. Because of these relaxing properties, opioids are used to treat both short-term and chronic pain. Opioids are also dangerously addictive and have a high potential for misuse. Fentanyl is a synthetic opioid, meaning it has been man-made in a lab. Okay, so let's talk about fentanyl and why it's so dangerous. Fentanyl is sometimes prescribed to treat severe pain. It's similar to morphine, but it's up to 100 times more potent. Because fentanyl is easy to make and mix with other drugs, it is increasingly found in drugs bought and sold in the streets like cocaine, Molly, Xanax, and other party drugs. Unfortunately, people often can't tell that their drugs contain fentanyl. If you are unsure of what is in the drugs you are consuming, fentanyl test strips can help identify the presence of fentanyl. But even if you get a negative result while using fentanyl test strips, you should still want to be careful. Fentanyl is so strong that the difference between an amount that will get you high and an amount that can cause an overdose death is very small. So what does it mean to overdose? In its simplest terms, an overdose is when your body has had too much of a certain drug and your system just can't handle it. There are many different substances that can cause an overdose, drugs like alcohol or stimulants such as cocaine, crack, or meth, but today we're going to talk about opioid overdose. If you or someone that you know is currently using, we want you to be aware of these common causes of overdose that can be prevented. Things like mixing drugs, like putting depressants on top of depressants, drugs such as alcohol, opioids, and benzos can dangerously slow your breathing. For drugs with opposite effects, like stimulants which speed up your heart rate, drugs like cocaine may not feel its full effects, so you might use too much. Lowered tolerance is another common cause of overdose. Things such as having abstained from using for some time. A person's tolerance can change in as little as 5 days. So if someone is coming out of jail, detox, or any hospitalization, that puts them at a high risk of overdosing. They should always start low and go slow. We feel that one of the most common preventable causes of overdose is using alone. If you're using by yourself and overdosing, there will be no one around to save you, so please don't use alone. Opiate overdoses are the leading cause of overdose death in the United States. In recent years, nearly 85% of overdoses have been caused by opioids. We want to highlight that you can have an opioid overdose from stimulants like cocaine, crack, and meth, which are not made up of opioids, but are now being mixed with fentanyl, which can cause someone to have an accidental opioid overdose. Of these drugs that people are using to get high, opioids are the only substance which have a rescue medication. This medication is called Narcan, or by its generic name, naloxone. Naloxone is a prescription medication that can rapidly reverse an opioid overdose. Remember, opioids work by binding to pain receptors in the brain. During an overdose, too many opioids bind to these receptors, which can cause a person to stop breathing. Naloxone works by knocking opioids off of those receptors. It reverses the effects of the opioids and can quickly restore normal breathing. Naloxone is completely safe It has no effect on anybody who doesn't have opioids in their system. Its only function is to block opioid receptors in the brain. It can give someone another chance to live. Naloxone comes in different forms. It can be injected or sprayed up the nose. Naloxone has a shelf life of 2 to 3 years. It is also temperature sensitive and should be stored at room temperature. If exposed to extreme temperature over a period of time, it may lose its potency. But we want to emphasize that a less potent Narcan is better than no Narcan at all. It is important to note that naloxone only lasts in the system for 30 to 90 minutes. When naloxone wears off, a person can fall back into an overdose, which is why it is important to call an ambulance and to never leave a person alone that is overdosing. Be aware that it may take multiple doses of Narcan to revive someone. A large percent of overdoses happen in public. That is why we are calling on all community members to join us in carrying Narcan and to help people stay alive. Rhode Island's Good Samaritan Overdose Protection Act was created to protect those who call 911 to save someone who is overdosing. The law states that someone shall not be charged or prosecuted for any crime related to the possession of a controlled substance or drug paraphernalia if that person is seeking medical assistance in good faith for someone who is overdosing. We hope that this law helps people feel safe when calling 911 during an overdose. In most cases, the first person to respond to an overdose isn't EMS. It's going to be someone like you or me. Be willing to engage with folks. Get involved. When you see someone sleeping on the floor or ground, check on them. Check to see if they're okay. Be a part of the community that checks on one another. The snoring that you might hear may not be from sleeping. It may be the gurgling sound of the respiratory system trying to get air. If someone is exhibiting non-responsiveness, blue or ashen lips, snoring or gurgling noises, slow, shallow, or not breathing, the first thing is to call an ambulance. Then get your Narcan out. Roll the person on their back. Do a sternum rub to check for responsiveness. Open up your nasal spray package, place your finger on the plunger, and press it all the way up. Wait 1 to 2 minutes and look for responsiveness by doing another sternum rub. If there is no response, administer again. Administer as many doses as needed or as many that you have available. Support the breathing if at all possible with CPR or chest compressions. If you need to step away, always remember to leave them in the recovery position. This helps the person breathe and allows fluids to drain from the nose and throat so that they don't accidentally choke on those fluids. Another way to administer Narcan is intravenously. Take out your intramuscular naloxone. Open up the naloxone package. Take out your syringe and your vial. Pop off the orange safety cap. Remove the safety cover from the syringe and insert the needle into the gray gasket. Flip it over and pull the plunger out all the way so that all the naloxone is in the syringe. You don't have to worry about bubbles. You want to choose an injection site in the large muscle group, such as the upper arm, thigh, or buttocks. There's no need to prepare the site. You're going to inject right through the clothing and push the plunger all the way down. Remember, use the protective cover to cover the needle so you don't stick yourself. You want to wait a minute or two, check for responsiveness, and repeat as necessary. Remember, if you need to step away, always leave them in the recovery position. And again, support the breathing if at all possible with CPR or chest compressions. You can save a life only if you are willing to carry Narcan, only if you're willing to engage with the community, and only if you're willing to get involved. We want to ask you to always carry naloxone and look out for one another. If you see someone that exhibit signs of an overdose, act. Now you know what to do.